In the previous session, we discussed about the computer-aided diagnosis. Now, in this session, we discuss about the concurrent, coupled, and correlated process for the biomedical signal analysis. This particular session introduces the notion of using multiple channels of biomedical signals to obtain information on concurrent, coupled, and correlated phenomena with the aim of obtaining an improved understanding of physiological system or obtaining a reference signal for various purposes. For example, that why we are making this analysis and how we are making this analysis. What are the different aids we require to perform the analysis? So this all that means we need to propose a one of the concurrent process. So where that will be aid with the easy calculations for these all parameters. The main point to note in that physiological systems should be studied from various approaches in order to gain multifaceted information. Most biological processes within the body are not independent of one another. Rather, they are mutually correlated and bound together by physical or physiological control and communication phenomena. Analyzing any signal process without due attention to others that are concurrent, coupled, or correlated with the process may provide only partial information and pose difficulties in the comprehension of the process. So the detailed investigations are required in this case. An investigation should explore the system or process of the interest from all the possible angles and use multidisciplinary approaches to identify several potential sources of the information. That is, the signals so obtained may be electrical, mechanical, biochemical, or physical among many possibilities and may exhibit interrelationship confounded by peculiarities of transductions, time delays, multipath transmission, or reflection, and filtering effect that may need to be accounted for in the simultaneous analysis. So what exactly happened here? We need to propose a technology. We need to propose a detailed analysis system where all the informations to be encoded with the relationship with the other system. So we are taking the case study of here biomedical signal processing. So in the biomedical signal processing aims to extracting significant information from physiological signals, which include heart rate, that we are going to measure the heart rate, blood pressure, we are going to measure the blood pressure, oxygen saturation level. This is the one of the very important parameter in the COVID-19. It is also proved that if the oxygen level is not maintained up to the appropriate level, it may be one of this that is what we say, it is one of the indication that your health level is deteriorating. So maintaining the appropriate oxygen level is also very important. Then blood glucose, we are going to measure the nerve condition. Brain activity. Brain activity is a very broader term, so we have to measure the different activities. For example, it is going for a brain tumor detection, or the nervous system is performing their operation correctly or not. So many things are there. So we have to measure the different parameters. So here some of the parameters are listed: heart rate, blood pressure, oxygen saturation level, blood glucose, nerve condition, and brain activity. These signals can be analyzed in order to provide information to physicians about what is going on in the body and allows them to make diagnosis if any sort of abnormality is detected. This ultimately allows one to determine the status of a patient's health through non-invasive measures. So some of the important criteria that we have to detect, because this all overall will have an impact on the human body, and that's why measuring these all is allow the radiologist or doctor to make a diagnosis. Because how you can detect the abnormality? How you can say that the person you are going to diagnose is in the normal condition or having some diseases? So overall, you have to include some of the parameters. So here is what you measure: the heart rate, if it is according to the normal condition or not. You have to detect the oxygen saturation level, whether it is according to the appropriate or suggested level or not. And it is not, you have to apply some therapy. Clear? So again, to measure the brain activity, whether the brain is functioning normally or not. So you have to measure, you have to detect some of the parameters from the brain, and then you have to make some analysis on that. So there is a different mechanisms are available, different sources are available through which you are extracting the information, by using computed tomography, that is CT, by using magnetic resonance imaging, that is MRI, by using SPECT, by so many different channels are available, through which you are getting the information, and then finally you are making some diagnosis on that all information, and you are relating the information to each other for making your conclusion. As technology is improving, engineers are discovering new ways to provide information to clinicians upon which they can make decisions. One of this improvement is through real-time monitoring, which can lead to the better management of chronic diseases, earlier diagnosis of the diseases, and early detection of the both heart attacks and the strokes. Biomedical signal processing is most useful in critical care setting due to the patient data needing to be analyzed in real time. By doing complex analysis of the body signal and having real-time monitoring, we can discover early indicators for how conditions manifest. It is important to relate the overall information. And as earlier in the last sessions, we discussed about the computer-aided diagnosis system. In that case, we are relating each and every information in a particular flow, and through which we are finally making our conclusion. Similarly here, through the different mechanisms, through the aid of the technology, we are providing some decision making system. So that is, we are measuring the heart parameter through ECG, we are measuring the brain activity through MRI or CT, and then finally we are relating these all information with the help of the computer system, that is by means of the algorithm. And then finally we conclude whether it is a normal activity or abnormal activity, and on the basis of that some decisions to be entered. Sometimes the decision is also suggested by the computer system, but early detection is always better. Examples of the biomedical signals and signal processing, that means how that with the help of what mechanism we are measuring the heart rate, we are measuring the oxygen level, we are measuring the different parameters. So these are we are going to discuss here. The electrical signals produced by the body that are extremely useful in diagnostics include electroencephalogram. In the very first topic, when we discuss about this particular unit, when we started about this unit, we discuss about EEG, ECG, and the different parameters. Let us again recall that what is the purpose of EEG? Monitoring method to record electrical activity of the brain. It is most often used to diagnose epilepsy, but can be used to diagnose other conditions such as sleep disorders, tumors, stroke, coma, encephalopathies, brain dead, etc. That means whether brain is functioning or brain is completely stopped functioning. That we are going to analyze with the help of EEG. Then electrocardiogram, most popularly rated as or referred as ECG, monitoring method to record electrical activity of the heart. This is normally used for measuring the activities from the heart. Indications for performing ECG includes suspected myocardial infarctions, suspected pulmonary embolism, seizures, fainting, cardiac murmur, etc. So when we receive ECG signal, again with the help of the electrical activity of the heart, we are getting that signal, and then finally we are interpreting that received signal, and then the radiologist will relate the entire information with the different diseases. Similarly, electromyogram, it is widely called as the EMG. This is used for monitoring method to record electrical activity of the muscle or the nervous system. EMG is used as a diagnostic tool for identifying neuromuscular diseases, that is Parkinson's, multiple sclerosis, Huntington's, etc., or as a research tool. If suppose you want to do some analysis on this signal, in that case you need a EMG signal. Clear? So this is not only for the muscle but also for the nervous systems. You can employ EMG signals. All three signals listed above require filtering of background noise. That means sometimes when you are capturing the signal, then that signal may be affected by the source or any other abnormalities. So that abnormalities should be removed. Clear? So some sort of the filtering is also always required, and often require conversion from continuous time to the discrete time for analysis. Because if the signal are in the continuous format, sometimes making the analysis on this is very difficult. And similarly, to proceed that signal or to make some analysis on that signal using the computer diagnosis system, in that case, the digitization of the signal is very much required. So what happened? That continuous signal should be converted to the discrete signal for further analysis. Now, how these overall systems should ensure with the devices. So here we are employed the biosensors. So biosensors is identified as a piece of hardware that can interact with either a biological or physiological system to acquire a signal for diagnostic or therapeutic purposes. They are analytical devices that converts the biological responses into the electrical signal. Biosensor technology incorporates a wide range of devices, which includes stethoscope. Obviously, when you meet your consultant, that is a doctor, very first that is check your heartbeat and other functioning with the help of the stethoscope. Thermometer, to measure the temperature, we use thermometer. Blood pressure cuff, so with the help of blood pressure cuff, we can measure the blood pressure. Blood glucose devices, so with the help of the blood glucose devices, we are ensuring the sugar level of the body. Pregnancy test, pulse oximetry. So suppose you are going to measure the oxygen level of your body, you can use pulse oximetry. Clear? So with the help of these devices, one should ensure that the functioning of the human body. Clear? So with the help of these biosensors, you can read the information. Once you capture this information and then make your analysis, and sometimes you can predict that what is the diseases are there, and what is the therapeutic process to be employed for curing that. Clear? So this is all about the unit number 1, that is biomedical signal analysis. So if you have any feedback or suggestions, please mail me at my mail ID is mentioned here. Thank you for joining us. If you require any informative